Hello and welcome. My name is Jodi Scholes, and I'm your instructor for the MBLEx review course. Today, we are talking about anatomy and physiology of the lower body. Yes, so the whole body can be a little bit overwhelming if we try and do it all in one class. So we separate the two, upper and lower, and take a deeper dive into both sections. Today is the lower body. And this class goes in 3 parts. So the first part is I'm going to give you some test-taking strategy. Super important. Please go ahead and listen. The second part is the learning. You need more than just learning to pass this test. I'm telling you, you got to be strategic. And that's why the third part of class is we dissect questions. We pull these questions apart, figure out what they're really asking, and then find the best answer. Because on the MBLEx, as in my quizzes and my tests, there are more than one correct answer. If you've already taken the MBLEx at least once, you know. It's like, it could be this, it could be that, it could be this, it could be... Yeah, you got to get to the best answer. And so that's what we practice here. All right. So my test-taking strategy for you is a bit more global today. It's a bit more of a life principle. And if you are hearing the sound of my voice right now, I want to remind you that this mission to be a massage therapist is bigger than you. It's bigger than you. Yes, you're doing the work. Yes, you went to massage school. Yes, you had this kind of desire to enter into the massage therapy profession. Not everyone wants to work with bodies. Not everybody loves it. It's your gift. It's your special sauce. It's one of the many things that makes you unique. Yeah. Yeah. So massage therapy, you may have picked the profession, but I'd like to suggest that the profession kind of picked you. Yeah. That this is something, and so often graduates of massage school will tell me when I ask, what brought you into massage therapy? And they'll say, oh man, when I was a kid, I used to rub my grandma's shoulders. When I was in high school, I was always the one giving back rubs. It is a natural part of you. It is part of who you really are. So this is just a process. Yes, you went to massage school. Yes, you may have taken the MBLEx already. Maybe you've taken it 5 times. I don't care. You're meant to do the work. And you're meant to be here. You're meant to... Some people talk about like divine order or predestination. We still have free will, right? We can still make all of our own choices. But I'm saying it's not an accident that you're listening to these classes. It's not an accident that you went to massage school. It's not by chance. It's not by coincidence. It's because it's a part of who you are. And because it's a part of who you are, you don't fail. You can't fail. You can't mess this up. Yeah, it might take you more than once to pass the test. Whoopie ding dong. Hey, a little adversity. I don't like it that you have to pay for it again, but that challenge puts a fire in your belly. In fact, we had a graduate just this week. She did not pass the MBLEx. And I felt like she was pretty prepared. I was wrong. I loved her attitude. Her attitude was, I hate to tell you this, Jodi, but I failed the MBLEx. She said, but I want to tell you, I am determined to study. I'm already back determined to study. And I was like, that is awesome. And what's really awesome about that is that this community supports moving forward, supports being like, all right, damn it, missed it that time, but I'll get it next time. And that's super healthy. Juvi, we seem to have a few people in the weight room, if you could check. it is super healthy to be in a community like this, where it's almost like you're back in school, right? It's almost like you're back in school. Yeah. So, remember when you had all that camaraderie? Yeah. You've got it here too. We are cheering for you. Before we started recording, I said, this is why part of the reason we come together in class and as a community, because when we bring our energy together, we're even stronger. Because on the days that, seem challenging, you can plug into something positive, plug in to a class, plug into this community, and kind of get your engines going again. So my strategy for you today is to remember, yeah, you picked going to massage school, but massage therapy, it picked you. Yeah. All right, let's move into our learning for today. Welcome back. Here we are. We're going to be talking today about anatomy. Ooh, there's a lot. There's 680 muscles in the body. There's 206 bones. You don't need to know them all, but you do need to know the important ones. So we're going to review the important parts of the anatomy and physiology that you'll need to know to guide you in answering questions on the MBLEx. So today our focus is on the pelvis, the lower limbs, a little bit of the ankle, and the foot. Yeah. So just so you know, and my hope today is that this sounds really familiar. My hope today is that you're a little bored because you already know it all. But I'd imagine there's a few things that you can polish up on. So let's get started. So today we're gonna we have these learning objectives. You'll be able to identify the regions of the lower body. You'll be able to describe the bones. You'll be able to identify the muscles. You'll be able to identify the bony landmarks, the joints, and navigate your way around the lower body. So the lower body includes the pelvis and the lower limbs. And the lower limbs are anchored to the axial skeleton at the sacroiliac joint, and a bunch of really strong ligaments as well. So the link, this is that sacroiliac joint, is the link to the pelvic bone and where the lower limbs are attached. And the lower limbs are the gluteal region, the thigh, the lower leg, the foot, and the joints that are there. So I said the axial skeleton, and the other skeleton is the appendicular skeleton. And I wanted to just remind you of what those look like. So here's the pelvis. And we said the pelvis is a part of the lower body. It is not part, it's actually part of the appendicular skeleton. So the pelvis, what we're going to be talking about today, is the appendicular skeleton lower body, right? So we've got the axial, which is the cranium, otherwise known as the skull, the thoracic cage, and the spine. It's like central nervous system versus peripheral nervous system, right? So, but in this case, the axial skeleton actually has the cranium, the skull, the vertebral column, and that thoracic cage. But today we're going to be talking about a section of the appendicular skeleton. Here, the pelvis and the lower limbs. So the pelvis is actually a part of the appendicular skeleton. That's sometimes a little confusing, right? Because it's big and you want to say, oh, is it a primary, part of the skeleton? It is, but technically it's a part of the appendicular skeleton. And here is a view of the pelvis. And let's review our regions. And you'll be seeing these, you'll be seeing a whole bunch of pictures of the pelvis. So this isn't the only one, but we'll start here. So this is the anterior view. Here is the ASIS. I love that this picture has the inguinal ligament. Sometimes we can feel that even on ourselves, the inguinal ligament. This is our gluteal region. So here we're looking at the posterior. So we've got the anterior thigh and the posterior thigh. This is also called the iliac crest. But we've got the anterior superior iliac spine, ASIS, iliac crest. Technically, where your butt folds over, it's called the gluteal fold. Here, and we'll just throw this in, the gluteal cleft, otherwise known as the crack of the butt. And if your draping shows the crack of the butt, it needs to be secured. No gluteal cleft. Yeah. All right. Here's the knee joint, the leg. So this is, should say lower leg, but sometimes we call it the leg, the whole thing. But again, with your questions on the MBLEx, if you are being asked a question about the leg, are they talking about the thigh or the lower leg? Definitely need to be careful as you drill down. All right, got the ankle joint and the foot. All right, so let's take a closer look at this pelvis. This point right in the front, is the ASIS. It is a bony landmark. You could say this whole thing is, well, here is the iliac crest, but the anterior, front, superior, up, iliac spine. So the ilium and the iliac spine. And this is just a lovely picture of the pelvis. You can see the spine here. And this is in the back. Here's the coxae, right? Versus the hip joint, which is the coxal. We'll cover it again. I'm just saying it for the first time. Here is the sacroiliac joint, and this is where the pelvis connects to the spine. The SI joint, right? The SI joint, sacroiliac, ilium. Oops, yes, the ilium. And that sacroiliac joint. All right, we've got a few other things here. The ischium is technically this part of the pelvis, this bottom part, the ischium. So the ilium, ASIS, superior, ischium, below. This is called the pubic synthesis. And this hole is called the obturator foramen. And we said this is the ischium. This little bony landmark you can palpate on yourself. Now, if you're not driving, if you're not, trying to have like boiling water in your hands or operating heavy machinery. All right, so go ahead and find your sit bones. Sit bones. Can you find them? Yes. Those are called your ischial, ischial, ischial tuberosity. So condyles, tuberosities, trochanters, condyles, they're all fancy words for bony landmarks. Yeah. All right. Ooh. But feel your sit bone. And you see here, this ischium, it's your ischial tuberosity. Right here. Boom, boom. Ooh, let's go back. Oh, we'll stay here. Okay. Let me just show you here. So this little, that's your sit bone. That's what you're touching right there, your ischial tuberosity. Why do we care about the ischial tuberosity? It's the attachment point for the hamstrings. All three hamstrings attached to the ischial tuberosity. So if you really want to work a hamstring, You got to follow it all the way up to the sit bone. And it's just a little behind the sit bone. Try it sometime. If you want to try it on yourself, grab a tennis ball and put it on your sit bone. And then sit on something hard, like the floor or a chair. You'll feel it. All right, here's another look. One more look at the pelvic girdle. So the ilium, the iliac crest, the iliac spine, attachment point for an inguinal ligament, the acetabulum. Ooh, have you heard of it? I know you've heard of it. I know you have. But it is the socket for the ball and socket. It's not a great picture here, but it's the socket for the ball and socket. So for the hip, it's the hip joint. It's the actual socket of the hip joint, the acetabulum. Here we see again the ischium. Now the ischium, it's your sit bone, but after the sit bone, it turns into the pubis. And here's that pubic synthesis. Yep. All right. So pretty cool, huh? Yeah, now you know where you are. Now you can navigate that pelvic region. So let's take a picture. Let's take a little look with some muscles. Woo, these are good ones. Here it is again. Here's your pelvis, right? Here's your sit bone. And here's the muscles that layer in there. Oh, so yummy. Look at that. So good. All right. Psoas minor, we don't really care about him. No offense. He's part of the whole region, but we really care about psoas major and then the iliacus. So psoas major. So this arrow points to here, but it's this muscle. So because it originates at your last rib. So the psoas major originates at your last rib, the lowest rib, and all the lumbar spine, L1 through L5, right in there. Comes out of there, passes through the pelvis, and we'll take a look at where it inserts in another slide. But that is actually the psoas major right there. That looks a little bit more like quadratus lumborum, to be honest. So, and then the adductors. The beautiful thing about the adductor muscles is that they're all named adductors. And you can be grateful, gracilis, grateful, G-R-A-T, grateful. So gracilis is also in that adductor region. And, you know, I don't care if you can name adductor brevis versus longus, to be honest with you, but I do need you to know where the adductors are. And that's on the medial aspect of the thigh, right? The medial aspect of the femur. Yes, beautiful. Speaking of the femur is a rock star of the lower body. It holds so much weight. It's where the weight from our upper body distributes into our lower body. So through the pelvis, into the femur. And the femur's got a few parts to it. So it's got a head. The head is the part that goes in the hip joint. So you can see here, the head goes in the acetabulum, this head of the femur. There's a little neck there. And then we've got a greater trochanter and a lesser trochanter. Trochanter, fancy word for bony landmark. But this lesser trochanter is actually on the medial aspect. So where your hips, when you put your hands on your hips, what you call your hips, your hip joint, that's where you're going to find your greater trochanter. And then the lesser trochanter is on the inside. The long part of this is called the shaft. And then at the bottom, we have both a medial and a lateral condyle. So here are a few facts about the femur. It's the longest and heaviest bone in the body. It is almost always, it is like what makes you tall. And it's about a quarter of your height. Not that you'll need to know that for the MBLEx, but I just thought it was kind of fun. Average length of the femur is 18 inches or 108 centimeters. We talked about the shaft, the long part, and then the condyles. So it has a head on the proximal, superior aspect, right? Up top, proximal. And then at the distal end, it has the medial and lateral condyles. Yeah. A great look at the femur. Thank you to the Cleveland Clinic for this image. Oh, and a review that, we're gonna, let's take a look at the muscles that surround this. So now we know the femur, right? Femur is in the upper leg, humerus in the upper arm, femur in the upper leg. Talked about these muscles already. Let's put them into action. So let's add a few more layers. So that was layers that were kind of stripped away. These are layers. So here's our quadratus lumborum, QL. That is a muscle you'll need to know, ladies and gents. If you are not familiar, if you think the quadratus lumborum is in your quad, check again. Yeah, none of the quadricep muscles are actually have quad in the name. I know, kind of tricky, huh? All right, here again is that, so in the talus. Nice picture. All right. That is enough for one session. Yeah, woo, good job. Now, let's dissect some questions, shall we? A little instruction on dissecting questions. And that is, we are going to read the question twice. But we got about another 15 minutes of class. We got 6 questions. Yeah. So we're going to read the question twice. We are going to eliminate at least one wrong answer. And then we are going to pick the best answer. When you take your practice exams, you have unlimited amount of time. Well, actually, technically you have 4 hours. But pace yourself to finish in under 2 hours, because that's the MBLEx, right? You have to finish in under 2 hours. However, I have seen some test takers finish in under an hour. It is very dangerous to take a test like that. Hear me. It's dangerous to go too fast. The reason being is you may miss the best answer. I mentioned at the start of class today, there's more than one right answer in your answer selections. On almost every question in the MBLEx, there's a good answer, but there's a best answer. These questions are written specifically to distract you. These answers, I should say, the answers have been put in there to distract you. I know, not very nice. However, with this strategy, you can be successful finding the best answer. Let's put it to the test. We're going to read the question twice. We're going to eliminate a wrong answer, and then we're going to find the best answer. Please identify the name of this anatomy. Please identify the name of this anatomy. And you guys can put that in the chat. Is this the appendicular skeleton? The axial skeleton?
Did you see it?
The exoskeleton? Or, I can't quite see that answer. Oh, the spine and cranium. Ooh, best answer. Remember, we're getting to the best answer. All right, let's eliminate one wrong answer. It is not the exoskeleton, right? The exoskeleton is on an animal. All right, so please identify the name of this anatomy. Is it the appendicular skeleton, the axial skeleton, or the spine and cranium? Let me look in the chat. Mayor, yes. Diana, Ms. V. Yes, Diane, good. Allegra, good. Hi, Allegra. I didn't see you earlier. Hey, Melissa. Yep. Greta, good. Sharita, yes. Kadeem, yes. Maya, yes. Tammy, pick one. Very good. Best answer? All right, let me see. We got one more coming in. Oh, swing and a miss on that one. It's the axial skeleton. So the appendicular skeleton is the extremities. The axial skeleton is, and it's not the cranium, the spine and cranium. That is not a complete answer. Spine and cranium. It is the spine and the cranium, but it's also the thoracic cage. Yup. Yup. All right. Good work. Good work. The acronym ASIS stands for blank. Stands for what? We've got anterior inferior iliac spine, anterior sacroiliac scale, anterior scoliosis ilium scale, anterior superior iliac spine. Be careful. Nice. Nice. All right, let's eliminate a wrong answer. It's not the anterior scoliosis ilium scale. No, that's just making stuff up. So you got two more answers. Good. Yes. Yes, yes, yes. All right, let's see. Diane nailed it. Mayor, yes. Maya, yes. Miss V? Good. Melissa? Sharita, yes. Greta, good. Kadeem, yeah, good. Good, Letitia. Good, Brianna. Good, Diana. Sorry. Brienne, yay, good. Brenda, yes. Tammy, yes. Good. Best answer, anterior superior iliac spine. I think that's misspelled. Iliac, it is. There's an extra C in there. Right. Which leg bone is responsible for balance and does not carry any of the weight of the body? Which leg bone is responsible only for balance and does not carry any of the weight of the body? Would that be the fibula, the femur, the tibia? Those are our four quads. Very good. And that is that. Yay, that's our finish line. Woo. That was a lot of work today, right? A lot of anatomy. Congratulations on finishing strong. Look, very tricky stuff today on those questions, just on the direction. Yeah, so good work today. Yay, you made it through. Now, do a body scan. How are you feeling? Is your brain tired? All right, just do a quick body scan. Let's take a breath in, put both feet on the floor, and just kind of scan from your ankles up to your knees, to your hips, to your belly, to your chest, to your head. How are you feeling? So you can do this body scan during your test taking, during your practice sessions, and while you're actually taking the MBLEx to get present again. Likewise, you can tell right now today if you're tired. If you're tired, that's good information because we're at an hour and 15 minutes. We're at an hour and 15 minutes, and you really need to be at an hour and 45 minutes. No tiredness right now. We need you to build that test-taking stamina. And how do you build test-taking stamina? You take more tests. Yeah, it's easy. You just take more tests for longer periods of time. Please do not fool yourself into thinking that you are test prepping when you take 10 or 20 questions. That is a lovely thing to do during the day. It's very helpful. It does not replace taking a full-length 100-question practice exam. We must build your test-taking stamina. And right now in class, it's a great time to kind of feel it. If you feel like you could keep going, good. That means your stamina is probably where it needs to be. And like I said, there's no right or wrong here. We're just doing an evaluation. So thanks so much for being here. I'm going to stay on, answer some questions from the graduates. I'll remind you that my name is Jodi Skolls. I'm your instructor for the MBLEx review course. I'm so glad you're here. I'm really glad you're here. And we'll see you again real soon.